Hi, my name is Richard Topping and you're watching another edition of Natural Wellness, What You Need to Know. Now in today's show we're going to be looking at heart disease, and today's guest is Dr. Martin Milner, a professor of cardiology and practicing cardiologist here in Portland, Oregon. Dr. Milner, thank you very much for joining us.
Thank you for having me, Richard.
You're welcome. Now before we get on with the show, why don't you tell us a little bit about your role as a natural medicine cardiologist?
Sure. I'm a board-certified naturopathic physician in Portland, Oregon. I've been in practice for 23 years, and I went to school here, medical school, a natural medical school. It's called National College of Naturopathic Medicine, and I've been the professor of cardiology there for the last 20 years. So over my career, I've treated about 20,000 patients with heart disease, seen a whole lot of things, learned a whole lot of lessons, and one of the main lessons I've learned is when it comes to heart disease, you really as a doctor want to start with diet, exercise, stress management, and natural plant products first in treating heart disease, and use drugs as a last resort. In Oregon, we're licensed to prescribe medicines like statin drugs for lowering cholesterol, so I use them when I have to, but only as a last resort.
How big a problem is heart disease in the US?
Heart disease remains the #1 killer, and it always has been in the last 20 years. There's over 900,000 deaths every year from heart disease. And when you compare that to the second leading cause of death, which is cancer, there's 500,000 deaths from cancer. And the rates of heart disease have gone up, the rates of death from cancer have pretty much stayed the same. There's 294 million Americans, and over a third of them, or over 60 million Americans, suffer high blood pressure, which is a huge risk factor for heart disease and strokes as well. So it's a very big problem.
1 in 3 Americans. That's an awful lot of people being treated for heart disease.
It sure is, and it's so many people that it makes a focus of prevention first and foremost, because really, we're all at risk.
So what causes a heart attack?
The way most people think about heart disease and heart attacks is there are arteries that feed the heart. They're called coronary arteries. And they gradually, over the period of a person's life, get damaged to the point where there's a blockage in blood supply through that artery to the heart. And once that blockage is so extreme, the heart actually dies. It's called a myocardial infarction. And there are a lot of factors that set up that coronary artery to become diseased that are gradual and insidious throughout a person's life, like damage to vessel walls due to long-standing high blood pressure. And LDL is one of those bad guy cholesterol molecules, which can very easily get what's called oxidized by not having enough antioxidants in your food supply and in your diet. And as that LDL oxidizes, it invades into the vessel wall and starts things going and starts a blockage forming. The research has also showed that inflammation has a big part to play in this whole problem of a coronary artery blocking off. And there's chemicals that are circulating in high levels in your body, like homocysteine, that can aggravate things further. But in the last 5 years, the newest research points toward inflammation, because we found that when you're chronically inflamed and in pain, and sometimes when you're not even in pain, you may still be chronically inflamed, and that inflammation damages artery walls.
Right, now is that inflammation throughout the whole body, or is it localized around the heart?
It can either be localized or throughout the whole body, and there are certain bacteria and other bugs that have been identified as the cause of local or systemic inflammation. So you can imagine a coronary artery that's gradually getting belted here and there, whether it's from high cholesterol or LDL being oxidized or inflammation or homocysteine. And that whole environment sets your blood up to clot and thicken. And that's yet another reason how you can form a heart attack. And some people actually get very sudden onset of heart attacks through an abrupt clot that lodges in the middle of a coronary artery, and then the whole heart distal from that artery ends up dying.
Now, is high cholesterol the only bad guy in the group here, or are there some other bad factors?
Cholesterol is definitely one of the main risk factors, but there are others. In fact, the greatest risk factor is family history. And we like to say that if you have your same-sexed parent having a history of heart disease at a very early age, that is a big risk factor for you. So we want to look at how we can modify gene problems in family history, and we can actually do that, which we'll be talking about later. And along with family history, probably the next biggest risk factor is being overweight, and if you can get to your ideal body weight, that's just of tremendous benefit in reducing risk for heart disease. So diet, exercise, and lifestyle changes are going to be very important. High blood pressure is a huge risk, and there's so much high blood pressure in our culture that managing blood pressure is a big challenge. And diabetes has been a huge epidemic that's increased significantly in the last 10 years, and diabetes is a big risk factor for heart disease as well.
I guess the sale of drugs is a good indication of the scale of the problem. Is it true that Lipitor, which is the cholesterol reduction drug from Pfizer, is that not the largest selling drug in the entire world?
That's right. When you translate that to the United States, over 30% of our senior citizen population is taking one statin drug or another. And that equates to about 11 million Americans. And as the demographics of our aging population move forward over the next 10 to 15 years, those numbers are just going to go up.
So statin is a medical term for a type of medication that reduces the cholesterol in the body. How does a statin drug work?
Well, there's actually two different sources of cholesterol. There's the cholesterol that you eat in your diet that makes up about 20%. And 80% of your cholesterol is actually made in your liver. And these statin drugs block your production of cholesterol in the liver. The concern I have is medical doctors really tend to abuse these. They use them as a first-line treatment, and their approach is very different in the use of prescription statins than mine, which focuses more on diet, exercise, and lifestyle first and foremost.
So you're saying that doctors actually abuse these drugs?
Well, I think they do, in my opinion, because they use them first and they use them foremost, and it's where they start in the treatment of high cholesterol. And I think that if you start with diet, exercise, and nutraceuticals, the risks are a whole lot less. Statin drugs have significant risk. It doesn't mean that everyone will develop side effects, but the risks are significant. You can end up with liver damage, so your liver enzymes have to be monitored. You can get very severe muscle aches and pains that you have to stop the medicine as a result of. And some people get low-grade muscle aches and cramps that they don't even realize is associated with statin use. Your brain is 70% cholesterol by weight, so if you take a statin drug for a prolonged period of time, it can significantly reduce concentration, and you can chalk it up to just being elderly and, you know, losing memory,
Right,
and not even realizing it has anything to do with the statin drug you're taking.
So given all these potential risks, why is it that doctors seem so keen to prescribe these statin drugs?
Physicians are well familiar with these risks, and when diligence is done, they will explain the risk factors to patients. But it's challenging these days. The costs of health care have risen dramatically. Insurance systems kind of force physicians to spend less and less time with their patients. They're trained to prescribe drugs first and foremost, so a lot of them just don't take time to create supportive counseling and lifestyle guidance to patients as a first-line treatment. They'll do what's quick, what's easy, what's their standard of care, which is prescribing statin drugs.